I'm Dr. Robert Snyder. I'm the Medical Director for the Bureau of Workers' Compensation, and welcome all of you to this open Q&A session on our new medical fee schedule rate tables. These rate tables were developed by Fair Health and are going to be free of charge to all parties, and were implemented to eliminate the need for either providers or payers to have to calculate their own fees. The only additional steps for determining the correct maximum allowable amount will be the additional necessary for certain physician specialties identified by the correct modifier, or for mid-level providers and for psychologists. It is hoped that these rate tables will reduce the inquiries to the Bureau, the disputes to the Medical Payment Committee, will improve billing and payment accuracy, transparency, and efficiency as well. These tables encompass outpatient services incorporated in our rules chapters 800-02-17 and 800-02-18 that are on our website. The inpatient services fee schedule, that is chapter 800-02-19, remains unchanged and in effect and is not affected by these rate tables, or nor are they included in these rate tables. Increased fees are offered to attract subspecialist physicians to treat injured workers, and this includes pulmonology, psychiatry, cardiology, and neurology, and to attract clinical psychologists. The increased rates for certain subspecialty physicians were in effect as of September the 25th of 2023, and those are not specifically reflected in these fee schedules, but I will go over the calculation for those particular subspecialists. Confusion over certain payment codes that we had that were CP codes that had different definitions in the CPT book were removed and replaced by state-specific Z codes for payments that have set prices. Certain laboratory procedure payments have been reduced to be in line with national and regional values. The initial estimates from NCCI, the National Council of Compensation Insurance, assessed negligible impact on compensation costs to the employers as a result of any changes that we've made in trying to attract hard-to-find specialists. The U.S. Congress just passed a partial reversal of the reduction proposed by Medicare for 2024 from 3.37% to 1.69%. What you see in these fee schedules today actually reflects that change to 1.69%. However, as of today, the Medicare lookup tool had not been updated from the previous 3.37%. So be aware that if you go to the Medicare lookup tool today, it is still not updated. These rate tables do not affect any contracts unless those contracts specify some percentage of the maximum allowable amount. In that case, contract prices would have to be recalculated or renegotiated. So now we're going to look at the layout of these fee schedules. For those of you that do work in Georgia or in South Carolina, these rate tables are very similar to theirs, and so you may be familiar with them. If you don't do other rate tables from Fair Health, I hope that this introduction will help you understand what to do when you receive the rate tables. The calculations. So what you see before you is what is the legend and information. And we are going to toggle back and forth between the different codes and this legend of the rate table so that you will be able to understand how these legends then apply to the different codes that we are going to see in this presentation. Let's start at the top. So what you see is found. This is an explanation of columns A, B, and C. So I'm going to go to E&M. And so here are the E&M codes for a perfect example. Let's go back up to the top, 99214. You can see here, this is the 99214 code, and you see columns A, B, and C. So we're going to go back to the legend to understand what those are. So you can see new code, revised code, add-on procedure, telemedicine eligible, and modifier 51 exempt. And so when we go to this, you can see that this is a revised code description, okay? And then you see here that these are telemedicine eligible codes. And so when you go back to the legend, then you will see how these different A, B, and C columns then apply to the E&M codes, and most of those that will include surgery, radiology, pathology, general medicine, and physical medicine, all will have these same columns at the top. And here's an example where under column B, you have an add-on procedure code, and that's for critical illness injury in certain professional components. So that's the columns A, B, and C, and that will be consistent through most of the physician management codes. Now, the next step is you will see different columns as we go through these that include the ambulatory payment classification, assistant surgery, base units, which are used for anesthesia services. So let's go to anesthesia services. And you will see in column C under anesthesia services, these are different because anesthesia codes are different. So these are the codes, here's the description, and here's the base units. These base units then follow the time sequences of Medicare. And so you'll have to understand that Medicare has requirements concerning time frames up to 15 minutes. And in certain circumstances, the next one can be charged between 8 minutes and 22 minutes. So just be aware of the Medicare rules concerning the time frames for base units, but you have here the maximum allowable number of base units for anesthesia services. And so that's the explanation of base unit. The codes, these are the CPT, HCPSC, and Tennessee specific codes that you will see in each category. That description is from the AMA by Fair Health. And then we will go into other ones. Facility maximum allowable amount is settings such as hospital and ambulatory surgery centers. So let's just go briefly to those. And you will see, let's go to surgery because this is where you're going to see these codes. So here are the columns: non-facility maximum allowable amount for certain CPT codes. In this case, I've highlighted carpal tunnel release surgery code 64721, and you can see the charge for non-facility, the facility maximum allowable charge, the follow-up days for that procedure, whether or not an assisted surgeon is necessary, and then here is the APC and the status indicator, and then the outpatient maximum allowable reimbursement. And so now let's go back to the legend. And here's those descriptions: the facility maximum allowable reimbursement, the follow-up days, and you can see that these have different codes to them. And in this particular instance, there was a 90-day follow-up code that's included in the procedure. Then you have the maximum allowable reimbursement. And then we will get on to non-facility maximum allowable reimbursement, facility maximum allowable reimbursement, and the status indicators. Later on, we will describe the rural and urban maximum allowable amounts, as those are applicable to ambulance services and to home health services. And so we will go into those at a later time. Assistant surgery, you can see here whether or not the assistant surgeon supports by documentation, whether it will or will not be paid, and if the concept does not apply. And so if we go on back to surgery, to this one, you can see it's a number 1. And if we go back to the legend, then you can see that number 1 will not be paid for that particular procedure. So that describes the columns under the surgery. Remember, the A, B, and C columns are the same. The code columns are the particular procedure code, whether or not there's any modifiers, and those modifiers will be present then if we go to the table for radiology. Now you will see the modifiers: the comprehensive one, followed by the radiology, followed by the professional component only, and then the technical component only. So that's where the modifiers come in. So let's go back.
Dr. Snyder,
yes.
May I stop you for just a minute? We've had several questions in the chat about Medicaid, and I just wanted to clarify that this session today is for Tennessee workers' compensation, which is based, the professional fees and hospital outpatient fees are based on Medicare, not Medicaid, and that TennCare would be the best resource to obtain Medicaid fee schedule information or cms.gov under Medicaid. And one other question, Dr. Snyder, that came up already has to do with ordering the fee schedule and the cost for that. And so I put in the chat that that's free, and you might want to expand on that's free for Tennessee stakeholders.
Correct. It is free to all Tennessee stakeholders, whether they be providers or payers. And Susie has provided the link for Fair Health orders, and those will be distributed shortly. We have just reviewed these fee schedules as of this morning, and we have released them. And so Fair Health within the next few days then will be sending out these fee schedules to individuals or organizations that have already ordered the fee schedule. And it is free. So let me go ahead and complete some other questions that are probably going to come up and that I haven't gotten to yet. We are going to go through exactly what the maximum allowable amounts that you see in each one of these columns mean, non-facility maximum, facility maximum, for each of these E&M codes, radiology, surgery, physical medicine, and general medicine. The last table that we will describe is the Tennessee specific Z codes. Now, let me say that this fee schedule is effective from April the 1st of 2024 through March the 31st of 2025. And that will be without any changes from Medicare quarterly updates. So if Medicare issues a quarterly update, that will not be applicable to Tennessee workers' compensation medical fee schedule. So this fee schedule, as you see it, will be effective from April the 1st of this year until March the 31st of next year. They will then be updated on April the 1st of 2025 to reflect the changes that Medicare makes. And as I said before, this is free and can be obtained from Fair Health website. There has been no changes in any of the modifiers or payment percentages from those that were effective September the 25th of 2023. And this fee schedule is intended to simplify calculations. There is no change from the rules. Certain services that were not priced by Medicare have been backfilled from Fair Health data, and that includes the dental codes that we will see when we go through the fee schedule. Okay, so we have started on the legend. So let's now go to E&M codes. As we talked about before, the established patient code. This A is revised. This is telemedicine eligible. Here is the code. Here is the description. And this is the non-facility payment and then the facility payment. This non-facility payment is 160% of Medicare. 160% of Medicare, which is the base allowable amount for Tennessee workers' compensation. So the amount that you see here on this table is 160% of Medicare. Facility maximum is also 160% of the Medicare allowable. And these are the maximum allowable reimbursements. So I hope that you can understand now that this one, for those individuals who are eligible for the base rate under Tennessee workers' compensation fee schedule, this is the allowable amount and will require no further calculations on the basis of either the providers or the payers. So that's E&M. Now, so we've talked previously about anesthesia. Here's the code, the descriptor, and the base units. In Tennessee, this would be multiplied by $75 per base unit to arrive at the anesthesia fee. Surgery codes. For an example, this is also the same as you saw the A, B, and C, and the code, the maximum allowable non-facility allowable amount, and this one is 200% of Medicare. This amount, 822.00, is the maximum allowable amount, and this is 200% of Medicare. Now, we will be updating the medical fee schedule handbook to reflect these, to provide further information concerning this particular amount and how each one of these tables is priced. So that's surgery. So let's go on to radiology. Here is an example: cervical spine. Radiology code, again, A, B, and C, the code, the descriptor, the modifier, whether or not it's combined, the professional component only, or the technical component only. This is 200% of Medicare. So for radiology, no further calculation will be necessary if a provider is putting the charge under comprehensive, or whether or not it's dividing it up into technical and professional components. Please note that this is 200% of Medicare, so no further calculation will be necessary from either the provider or the payer. Laboratory. So pretty much the same with laboratory. Here is the code, and here's the descriptor. And this is already the calculation specific to laboratory, and no further calculation will be necessary for either the provider or the payer for laboratory services that are listed under these codes.
And Dr. Snyder, you do have a couple of questions. I didn't want to lose them before we go too far. So there's a question about the qualifying specialists that are paid 180% of Medicare, and that is still appropriate. But if you want to address that back with the codes, the E&M codes, or the codes that can get 180%.
We will go over that in general medicine in just a minute.
Another question that we had has to do with, what if the stakeholder is outside of Tennessee? Is it still free?
Yes.
Thank you.
Laboratory. So laboratory is the charge, no further calculation necessary. Pathology codes. These codes are already 200% of Medicare. So no further for pathology that follow under these codes. No further calculation will be necessary. General medicine. Now here is where we will talk about the subspecialty. So here is an example, okay, and I have highlighted the Psychiatric Diagnostic Evaluation Code. This is 90791. This calculation is 160% of Medicare already. So this calculation now for eligible subspecialists, such as psychiatrists, occupational medicine, neurology, or cardiology, the code then would be multiplied by 1.125. That would then be equivalent to 180% of Medicare. So for eligible psychiatrists, and for codes for occupational medicine, for PM&R, these codes then would be multiplied by 1.125. So a psychiatrist then would charge 1.125 times this non-facility maximum allowable reimbursement. Let's go on to physical medicine. This is already 130% of Medicare. For physical therapy services, this would be the charge, non-facility and facility maximum allowable reimbursement charge without further calculation. Dental codes. These dental codes are already, since they are not priced by Medicare, these dental codes then are at 60% of the national average based upon fair health data. And so these would be the charges for dental procedures without any further calculation. Home health services. Here are the codes for home health services, the maximum allowable reimbursements. As you can see, follow-up days, if we go back to the legend, XXX means global period concept does not apply to these services, and assistant surgery is not applicable either. And so they do not have an APC or outpatient maximum, but do have a status indicator. But these maximum allowable reimbursements then would require no further calculation. Are the ambulance charges. Again, it follows the same pattern as home health services. And now here is where we have the urban and rural maximum allowable amounts. Let's get a perfect example. Let's take basic life support mileage. Urban mileage and rural maximum allowable are the same for basic life support. And we will go back to the legend then. And here is the description for rural and urban. Okay, so this gives you the idea as to what these maximum allowable amounts, and that's applicable then to ambulance services. We go on to, these are HCPSC codes that have to do with supplies and durable medical equipment. Let's just pick one out, infusion supplies with a pump. The urban maximum allowable and the rural maximum allowable are different in this circumstance. Follow-up days are not applicable, neither are assistant surgery, and there's an end status indicator, which means that there's no status indicator for these. Okay, so that's DME and HCPSC services that are used under these codes. And there's quite a few of these, as you are quite aware, so they go out well through over 1,000 codes. Now, the last one is our state-specific Z codes. For those of you that do any work in Colorado, you'll be familiar with the Z code concept. So these are specific codes that would be add-on codes or specific standalone codes for certain services that occur. And I will run through these. The first one, instead of the confusing 99 or 199 code that we previously had used, we now have the Z code, Z0110, a missed appointment, new patient, and then the missed appointment follow-up patient. For information, if there in fact is further information provided concerning causation analysis, then this would be new information evaluated by the physician, and that would be coded as Z0210 for further correspondence concerning causation, and then each additional hour. Instead of the report code that was previously used for the completion of the impairment rating, the code Z0310 would be applied. If an individual was seen by the physician, released the date of maximum medical improvement was the date of the visit, and the permanent impairment was evaluated and the form completed, not only would there be a E&M charge, but then there would be the Z code for the completion of the form. And this would be done either the same day or on an alternate day. Case management meetings and special reports, 2 Z codes, Z0410 and Z0411. Independent medical evaluations. Instead of the CPT code for independent medical evaluations, we have 2 codes, one for the first hour and then each additional half hour after that. Copy fees, you'll have to see the rules on those. These copy fees are usually 20 cents per page, and so Z code would be used instead of a CPT code. And then the new certified physician program. These are individuals that are specifically trained in Tennessee workers' compensation. These individuals are listed on our website under Certified Physician Program. And so in addition to the normal E&M or general medicine codes, then you would see an additional Z code that would be on the bill that would be payable to these physicians, first for a new patient visit, an established patient follow-up visit, or the permanent impairment rating form. So you would see that if the permanent impairment was rated, you would see a Z0310, and in addition, if it was a certified physician, you would see a Z0817. So for the payers, when you see these Z codes, specifically to the certified physician program, then you would go to our website to confirm that those would be payable to those physicians.
And Dr. Snyder,
Okay.
there's a question on by review or by report and how those codes are priced.
That would be priced according to the report itself. It would not be any different than what we have previously done. And I believe you said that's 80% of the usual and customary charge?
Yes, sir.
Okay. There's no change for that.
No change, that's correct. There's also a question here about when the medical fee schedule handbook will be available. And I just wanted to comment on that question as well. The handbook, we hope to have that up very, very soon, but there is nothing in the handbook that is different from the rate table here or from the rules. The percentages have not changed. So certainly the rules, Chapter 18, have all of the professional rates, percentages of Medicare available. So what the handbook will update would just be the examples. We have a few professional examples, the RVUs and the conversion factor will need to be updated. And then we'll need to go back and put in rate tables, percentage of rate tables. So those will be coming very, very soon, but they're not changing. As Dr. Snyder is saying, we haven't changed anything. It's just the fee schedule is updated for the 2024 Medicare changes.
Now, the last part of the legend, board certified and board eligible physicians may be entitled to additional reimbursement related to their subspecialty. And so we've just gone through those, how to calculate the psychiatrists and occupational medicine physicians by taking the general medicine code and multiplying it by 1.125. For non-physician practitioners, psychologists, PAs, and nurse practitioners, properly licensed and certified to perform services other than assistant surgery shall be reimbursed at 85% of the fees listed in the fee schedule. The assistant for surgery is according to the rules. So if you have a charge for assistant surgery, then you go to the rules which follow Medicare. So that completes my part of trying to explain the legend. I'm going to go through one more thing that has to do with orthopedics and neurosurgery, okay? In the state of Tennessee, orthopedics and neurosurgery for surgical procedures, those individuals that are board eligible or board certified then are eligible for 275% of Medicare. As we talked in the surgery, this is already priced at 200% of Medicare. So to reach the level of 275% of standard Medicare, you would multiply this number by 1.375. So for an orthopedic surgeon or for a neurosurgeon doing this procedure, the maximum allowable charge would be 1.375 times this figure. And so those calculations, we will be explaining those in the handbook, but for those particular subspecialists and for orthopedics and neurosurgery, these would be easily calculable. And the modifier for orthopedics and neurosurgery would be ON. The modifier for the subspecialty medicine is OP. And the modifier then for nurse practitioners, PAs, is NP. Okay, I've covered pretty much everything that I wanted to cover, so we're open for questions. We've already taken a few, but
So, Dr. Snyder, we do have one more question. If you could go back and clarify again on the certified physician Z codes for them. The question is, do CPPs get reimbursed for a general Medicare service in addition to the Z code, or do CPPs need to bill E&M codes with the Z code?
E&M codes with the Z code and also general medicine codes or other applicable codes for the certified physicians. So if in fact a certified physician is an orthopedic surgeon, then on top of the CPT code for whatever visit they have, either E&M or for the surgery visit, then they could include the extra Z code. Again, these are only for these three items. That is a new patient visit, an established patient visit, or completion of the permanent impairment. It would not specifically apply to an extra surgery code, but would to E&M or actual general medicine code.
And might I add to that to let bill reviewers and payers be aware that you could potentially see 4 codes billed for a date of service if the certified physician happens to be the authorized treating physician and evaluates the return visit at which MMI is determined. You might see a subsequent visit code. You might see the office visit code. You'll see that Z code for the subsequent visit. If that doctor also calculates the impairment rating and completes the C30A form that day, you will see the charge for the C30A form. You may also see the CPP additional fee for filling that form out. So there could be 3 Z codes billed on the one day and an office visit for a CPP physician, potentially. And there's one more question, Dr. Snyder. To be clear, these tables are for all outpatient professional services.
Yes.
This is Melissa from Fair Health. I just wanted to clarify one thing in case, there's folks here who don't know. Dr. Snyder, if you could just go to maybe the surgery tab, really any of them, but so just to clarify, the non-facility maximum allowable and the facility maximum allowable, these are both for the professional services, billing the physician or professional services. It's just dependent on the site of service. So if the service is being done in the office, that would be the non-facility maximum allowable rate. If the service was being done in, for example, an outpatient facility or an ambulatory surgery center, then they would bill the facility maximum allowable for that. So, but in either case, it's for the professional services. The facility bill would be different.
Thank you.
2 more questions, Dr. Snyder. Will the example that I just explained basically be included in the fee schedule handbook? And we can include that if there's a question on if you think we need to clarify that. Second question.
So next question, is there a way to view the fee schedule online on the website? No, you will get the fee schedule by ordering it from Fair Health. That way we'll know who is obtaining the fee schedule. We're not trying to limit it, and it is free. So all you have to do is order it through Fair Health. Now, question, Tara Miller asked, does the outpatient MAR already include the 150% markup? So this is for E&M codes. This is already 160%.
And I think the question may be referring to column L, if there is an outpatient hospital or ASC fee on. So if you'll go to maybe the surgery tab and they can see that, yes, I believe, and Melissa, correct me if I'm wrong, but yes, that OPMAR already includes the 150% for hospital outpatient services, the facility services, and for ASC services.
So
And
to
that-
answer the question, how do you figure the facility allowable? It's already listed here. Outpatient maximum allowable facilities of 150% of Medicare for outpatient hospital services and ASC services. And what is the surgery markup for facilities? It's 150%.
But all of the Medicare status indicator codes, their edits do apply.
Further questions?
How will this affect calculating CAPCs for facilities?
They're already calculated, I believe, right?
Yeah, correct.
How often will this fee schedule be updated? Example, Medicare may update their APC rates quarterly. Will Tennessee just adopt these rates yearly?
Yes, yearly. Any changes Medicare makes after April the 1st, after today, will not be reflected in the fee schedule, nor will it be effective for payment for Tennessee workers' compensation. Fee schedule will be updated yearly starting next year. So April the 1st of 2025, there'll be an update. And will be based upon changes that Medicare makes for 2025.
Are the CMS MUE edits applicable for Tennessee workers' comp DME?
My answer would be yes.
And I believe that is the discussion we did have prior to the last rule revision, that those would be. But I can go back and check the rules and send a link. And Melissa, feel free to jump in.
Yeah, I was just checking the rule. My assumption would be yes as well, but it might be worth verifying. The rule does specify the National Correct Coding Initiative edits are adopted, and the MUEs are part of that. So I think that should cover that.
Yes, thank you. And I pasted a rule in there from Chapter 17 regarding that section.
We appreciate all the help that Fair Health has given us on these, and I hope this will create a stable and efficient and transparent process for billing and payments for services under Tennessee workers' compensation.